Good morning, everybody. My name is Jorge Acosta. I'm a topic transcatheter aortic valve replacement with a balloon expandable valve in low-risk patients. This is my information about my new words, social new words. Definitions. Transcatheter valve replacement TAVR with a balloon expandable device as a ringer has alternative to surgical aortic valve replacement CAVR for the treating of certain aortic stenosis among patients who are on intermediate or high risk for a death for surgery. How do heart valves functions? This is the video about the topics.
There are four valves inside the heart. There are two valves on the right side of the heart, two valves on the left side of the heart. The two valves on the right side of the heart, called the tricuspid valve and the pulmonic valves, are not usually involved in adult heart disease. Sometimes there are diseases that some of the babies have related to the valves on the right side of the heart, but generally adults do not have problems too much with the tricuspid or pulmonic valves. Now, all the valves in the heart act as one-way valves. They open to allow blood to go in the forward direction, and they close so blood doesn't come back where it came from. So I used an analogy. It's a little bit like the Panama Canal and the locks in the canal. The locks open to allow the water to go forward, the boat goes forward, and then the lock closes behind it so the boat doesn't go backward, and that's one lock at a time. Well, the valves act fairly similarly within the heart. The two valves on the left side of the heart, the mitral valve and the aortic valves, are actually not infrequently involved with heart diseases of adults. Typically, the mitral valve opens to allow blood to exit from the upper chamber to the lower chamber, and then it closes. So the heart now, when it gets ready to pump the blood, all the blood will go forward instead of going backwards. However, in cases where the heart has enlarged, now sometimes the valve leaflets no longer touch. The heart itself stretches out, and that causes the valve to actually no longer touch, and it doesn't close completely. Now when the main pumping chamber squeezes, some of the blood can go backwards. In mild cases, we can treat this medically. In more severe cases, we have to replace the valve. The aortic valve, which is the last of the valves, opens to allow blood to exit the heart, and it closes so that blood doesn't come back into the heart. The most common disease of the aortic valve actually involves gradually narrowing of this valve. However, there are some cases where the aorta, the main blood vessel after the heart, also can enlarge and cause the same problem where we have a leakage of the aortic valve. So the valves normally act as doors. Open the door to allow blood to go from one chamber to the next, or one chamber to the aorta, and then closes so the blood doesn't wash back where it came from. But sometimes these valves themselves can be involved in disease processes of the heart.
Aortic stenosis is a progressive disease that keeps the aortic heart valve from opening and closing properly. The heart then must work harder to push blood through the valve. Eventually, it weakens and increases the patient risk of heart failure. This is about the aortic stenosis video.
Aortic stenosis is a heart valve disease that affects as many as 1.5 million Americans. It becomes more common with age, affecting 1 in 10 people over the age of 75. Left untreated, severe aortic stenosis leads to decreased quality of life, heart failure, and even death. Aortic stenosis occurs when the aortic valve, the main outlet for blood being pumped from the heart to the body, becomes abnormally narrowed. In older adults, stenosis is typically caused by wear and tear and the gradual buildup of calcium deposits that stiffen and narrow the valve, keeping it from opening properly. As the valve narrows, the heart has to pump harder to push blood throughout the body, and this can lead to symptoms like fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. While not all aortic stenosis patients experience symptoms, 3 out of 4 older patients with severe aortic stenosis do. However, many dismiss these warning signs as normal aging. This often leads to the underdiagnosis of aortic stenosis. Those that experience aortic stenosis symptoms have diminished quality of life, making everyday activities like climbing stairs and walking increasingly difficult. If you or a loved one has aortic stenosis symptoms, it's important to seek medical attention promptly. Simple tests are used to diagnose aortic stenosis. Aortic stenosis produces a very distinct heart sound, a murmur, and is usually detectable with a stethoscope. But other tests may be necessary. Over time, aortic stenosis strains the heart, causing the heart muscle to become thicker, weaker, and scarred. Without treatment, severe cases lead to heart failure and death. Medications can treat chest pain or other symptoms, but none can reverse aortic stenosis. Only repairing or replacing the defective valve will eliminate aortic stenosis. Without surgery, 50% of patients with severe aortic stenosis don't survive more than 2 years after the onset of symptoms. Aortic stenosis treatment typically requires aortic valve replacement surgery, or AVR. This surgery replaces the defective valve with a mechanical or tissue valve. AVR improves quality of life and increases survival in most patients. But those at high risk for surgical complications may not be good AVR candidates. Fortunately, recent medical advances give new hope for those who cannot tolerate more invasive surgery or are at high operative risk. TAVR, or transcatheter aortic valve replacement, is a new technique in which a valve is placed by inserting a catheter through an artery in the leg and threading it to the heart. This procedure is minimally invasive and does not require the chest to be opened. There are risks associated with TAVR, including stroke and damage to leg vessels. Aortic valve replacement is still the preferred treatment for most aortic stenosis patients, but TAVR represents a potentially life-saving alternative for those who cannot tolerate more invasive surgery. If you or a loved one has been diagnosed with aortic stenosis or is experiencing symptoms of aortic stenosis, talk with a healthcare professional right away. Get prompt medical attention for fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. And remember, aortic stenosis is a treatable condition, and older age is not a barrier to valve replacement. Brought to you by the Alliance for Aging Research, with support from Edwards Life Sciences.
Applications in medicine. Transcatheter aortic valve replacement has become a feasible alternative treatment for patients with severe aortic stenosis AS who have a contraindication or are at high risk for surgical aortic valve AV replacement. The patients who underwent TAVR have more rapid improvement in the NYHA class, set-minimum wall test distance, and KCCQ score than those who underwent surgery. This is videos about the surgical procedure. This is a video about the patient testimonial.
Shortness of breath. And it got to where even just walking out to the mailbox and coming back in was not good. It was frightening, the thought of it. It's getting a little worse each time. When I was 31, I had stage 3 breast cancer, and there was no chemo at that time. So I had 21 treatments of cobalt radiation. I was assigned to Loma Linda Heart Institute. I knew I was in the right place. And they wanted to check my sternum to see if there was calcification. When Dr. Wazook got that result, he said, there's no way we can do that because if we were to open you up, it would crumble. Fortunately, the TAVR had saved my life. The Loma Linda International Heart Institute gave me my life. The patient experience that I had, it was everything a person could hope for. I checked in at 5 o'clock in the morning, and the next day I was home by 5 o'clock. Since then, I've already felt a real difference. It's a new life for me.
Pros and cons. TAVR replacement valve generally functions better than valve used in the open heart surgery. TAVR valves leak less and generally lasts longer than other types or replacement valves. The recovery post TAVR is much easier than that of open heart surgery because there are no large incisions in the chest. Cons. TAVR, of course, isn't without its risks. Generally, risks of this minimal invasive procedure include blood-based complications, heart attack or heart rate abnormalities, kidney disease or problem with the valve is stroke and infections. This is a video about the risks, the little risks of the.
The risks of transcatheter aortic valve replacement are pretty limited at this point. We've come a long way in the 15 years that the procedure has been utilized. We've done a lot of the research here in the United States as well as abroad and have learned to make it less and less traumatic and less risky. We did start, in fact, with the riskiest of patients, those who are really inoperable and the most frail. And now we've been able to apply it to lower and lower risk patients. The risk, obviously, that everybody worries about most is whether they're going to survive the procedure. The risk for this procedure is down around 2%, which is quite low, and in fact lower than most surgical risks for patients who have surgical aortic valve replacement. The second most scary thing is stroke. And at the beginning, we were having stroke rates that were in the 5 to 10% range, and now it's under 1%. So not zero. However, we do know if we don't treat these patients, they have a 100% chance of getting worse. We take a limited and hopefully controlled risk of death and stroke of under 2% or even under 1%, knowing that you've reversed the ratio completely from 100% chance of getting worse and not doing well long term. Aortic stenosis, which is the reason we utilize transcatheter aortic valve replacement, is as lethal as many cancers. In fact, if you have symptoms from it, about 50% of the patients are not alive at 2 years if they go untreated. So we take it very seriously when somebody comes in with aortic stenosis and has symptoms, which can be chest pain, it can be shortness of breath, it can be dizziness, and even fainting. That we try to promptly treat these patients if we can, whatever is the best technology available, whether it's surgery or whether it's transcatheter aortic valve replacement. Try to move very quickly towards therapy.
ISUS applied in Ecuador. ISUS is a life-saving technique for people with aortic stenosis which symptoms are threatening life. The clinical cardiology unit and surgery area, cardiothoracic unit, and the hemodynamic unit of the Hospital Teodoro Maldonado Calvo since 2015 implemented a new procedure, transcatheter aortic valve replacement for aortic stenosis. Doctors in this hospital only have one type of valve for intervention with TAVR, which is the core valve. Conclusions. Among patients with severe aortic stenosis who are at low surgery risk, the rate of the composite of death, stroke, or hospitalization at 1 year was significantly lower than with TAVR than with surgery. And that's it, and thank you for watching my video. Thank you.